Approximately 3% of patients experience an allergic reaction to collagen replacement products and cannot use them. Because of this risk, anyone considering collagen replacement has to have a skin test with the product to determine their potential for allergies. If after 1 month they have had no reaction to the small skin test, they can be treated with the collagen. Approximately 1% of those with a negative skin test go on to develop hypersensitivity to the collagen replacement. Certain people cannot or should not receive injectable collagen. Such patients include those who are allergic to collagen, are pregnant or breastfeeding, are on corticosteroid or immunosuppressive therapy, are sensitive to lidocaine, or have a history of severe allergic reactions, or are planning to undergo desensitization injections to meat products. Complications with collagen injections are rare but do occur. You should obtain a detailed and thorough list of them from the physician or nurse treating you before you decide to undergo this treatment. Have them also explain the possible alternatives. If you do not have an injection, you will not have the risks of the injections. Prolonged and significant swelling or bruising can occur. Very rarely, infection might occur or superficial scabbing or sloughing of skin, which could lead to a permanent scar. For those patients who already have a history of herpes outbreaks on the face, another outbreak could be provoked with collagen injections. Although no direct causal relationship has been established, some physicians have reported the occurrence of connective tissue diseases such as arthritis in patients injected with collagen products. There are additional risks as well. Be sure to ask your physician for a complete list.
Patients should be cautious of who administers the injections of collagen and Botox. These treatments were designed for and should be used by healthcare professionals such as doctors and nurses. Often these injections may be advertised as available in non-medical settings or facilities where it is not under the direct supervision of a physician. The personnel doing the injecting often do not have the necessary understanding of the relevant anatomy, nerves, and muscles, and have very limited training, and are not set up to handle the possible complications that may arise.
Collagen replacement injections are not the only available tissue fillers. Be sure to ask your doctor about the advantages and disadvantages of some of the others, including Alloderm, Autologen, Restylane, Perlane, hyaluronic acid, Radiance, and fat injections. The following is a short video of a patient receiving collagen injection in the nasolabial fold area. Special thanks to Jody Emery, RN, Beverly Hills, California, for providing pictures and video of the patients for collagen and Botox injections.
We'll probably cut that though. This is just a trick to make it inject a little easier. Watch out for the needle.
Is this Botox or collagen?
Collagen. Let that big drop of blood coming out.
I didn't even get it.
Good.
Yeah.
Great.
Thanks, Garth.
Very good.
Do you think you need any more? Do you want any more?
So happy.
Do you want any more in this area?
If you've got left, yeah, just throw it in there.
following segment of this video is about dermabrasion, chemical peels, and laser resurfacing.
Dermabrasions, chemical peels, and laser resurfacing also improve wrinkling and other signs of aged skin, such as pigmentation and texture issues. These accessory procedures are indicated and provide a solution for problems not addressed by a facelift or removal or elevation of excess skin. Your surgeon may decide to utilize some of them as an added treatment, along with your facial surgery, to provide enhancement of the overall result. The significance of these additive procedures is that they can change the quality of your skin, but do not remove any excess skin.
In the most general and simplistic description, dermabrasion, chemical peels, and laser resurfacing do the same thing, just in different ways. They all provide ways of removing superficial layers of the skin, including wrinkle, pigmentation, and texture problems. After these top layers of skin are removed, a new layer of skin is able to emerge or grow back, hopefully with an improved and more youthful appearance.
There are advantages and disadvantages with all these procedures. However, the indications for choosing them, recovery period, and risks are basically very much the same.
This is a photograph of a dermabrasion machine. Dermabrasion mechanically removes surface layers of the skin which has the wrinkles, pigmentation, or texture problems. The skin is sanded down as if sandpaper on a spinning wheel was applied to the surface. Chemical peels use a chemical to create a controlled burn on the face, which later peels and removes a layer of skin. The stronger or more concentrated the chemical, the deeper the burn, and the deeper the layer of skin that is removed. Laser resurfacing involves the use of a laser which, when applied to the skin, can remove layers of skin at a precise depth.
In general, if your problems are very delicate or superficial, a less invasive treatment is effective. The deeper or more severe your skin problems are, the stronger or more invasive the treatment must be to achieve a similar result. The stronger or more invasive the treatment, the longer the recovery period and the greater the risks. Thus, if the selected treatment is performed appropriately, the downtime, recovery period, and risks are directly related to how bad your skin problems are or to the extent you want them improved. In general, the darker your skin, the higher the risk of certain problems.